Every day that goes by, I think about my dad. Every day. I dream about it every night. I just can't stop reliving the care and the treatment he got, what I could have done better. Yeah, just see Dad all the time. I miss him so much.
Last year, Lee Long put his father Maurice into a Tasmanian government-operated aged care facility at the Beaconsfield District Health Service. Within a week, Mr Long says his father's health had deteriorated.
There was something wrong with Dad. He was going downhill. Dad was turned into a zombie. He could hardly walk. He couldn't talk. He was just zombie type.
Mr Long also alleges staff at the facility didn't seek consent before chemically restraining his father.
They started sedating Dad with medication due to his undiagnosed dementia for pushing a buzzer 19 times in an hour.
Family members also found bruising on his body.
All around his neck, on his arms, all sorts of things. Quite a lot of bruising. It shouldn't be there. We need explanation why it was there. What happened to Dad?
Mr Long filed a complaint to the Tasmanian Health Department about his father's care. While he's yet to receive an official response, department staff acknowledged in emails that his family's experience was awful and their concerns were managed poorly. The union that represents aged care workers says facilities are understaffed.
The impact for residents is that they often have to wait to get the care that they need. They're delayed in going to the toilet. They're delayed in when they get out of bed. We keep hearing awful stories that nobody else in the community would accept. So why do we accept it for older people just because they're in a nursing home?
In the last financial year, the National Aged Care Regulator received 150 complaints about residential care in Tasmania. And since the start of the year, the regulator found 6 aged care facilities in the state were non-compliant with its standards, including another state government-operated facility that was also identified as having issues with chemical restraint.
There's no way it is acceptable that in public-run institutions in Tasmania that we shouldn't be meeting the national guidelines.
It actually really disgusts me because I think every human being is worthy of being treated with dignity and respect, and actually that should be irrespective of their age.
Unhappy with the care at Beaconsfield, Lee moved his father into a different aged care facility.
I was hoping things would come back to, hey, Dad's good now, we fixed it. Sadly, he died. Yep. The damage was done. You sad about Big Pop?
The Department of Health says the family's concerns are being taken very seriously and are being actively reviewed. It says it empathises with anyone whose experience in Tasmania's health system falls short of expected standards. April McLennan, ABC News.